Hello, my dear students. I'm Dr. Vaishaly Bharambe. Over last 5 months, I've put up a lot of videos and I've received a lot of comments from students. The most common comment has always been, Madam, why don't you help us solve MCQs as well? So then, okay, fine. Let's begin to solve MCQs from today onwards. The first lot of MCQs I'm going to put up for you is of the inguinal region. So there will be a part 1, part 2 and part 3. In part 1, we'll just take a look at the basic anatomy once. Part 2 and 3 onwards, we will be looking at anatomy of hernias as well. Okay, so let's just dive in, students. Brush up quickly the inguinal region anatomy. Okay, so anatomy of inguinal canal only through diagrams. Don't expect me to teach you theory now. You should know it. In case you don't, of course, there are videos uploaded on this anatomy as well. Description section में उसका link दिया हुआ है. You can take a look. Right. So what do you see here? You're seeing the anterior superior iliac spine. You're seeing the superficial inguinal ring here. Okay. As you know, superficial inguinal ring is a gap in the aponeurosis of external oblique. First point you should remember. This is the deep inguinal ring, which is a gap in fascia transversalis, point 2. Extending in between the two is your inguinal canal, which is about 4 centimeters in length. Inguinal canal extends from deep inguinal ring to superficial inguinal ring. It is 4 centimeters in length. Arching over it, you can see the internal oblique here. You can see the transversus abdominis here. Okay. If you recall, when they contract, they result in the shutter mechanism. Okay. You can see two of them uniting medially to form conjoint tendon. Conjoint tendon protects the superficial inguinal ring from behind. Okay, so this is the basic anatomy you should know. Inferior epigastric artery lies medial to the deep inguinal ring. Let's take a transverse section now through the same inguinal canal, and here it is. This is your deep inguinal ring, gap in the fascia transversalis. This is superficial inguinal ring, gap in the aponeurosis of external oblique. And this, my dear students, is the inguinal canal. So who forms its anterior wall? Who forms its posterior wall? Very commonly asked questions. So anterior wall is formed by skin, superficial fascia, external oblique, internal oblique. But is it external oblique muscle? No, it is external oblique aponeurosis. Okay. So 1, 2, 3. Skin, superficial fascia, external oblique aponeurosis, internal oblique are forming the anterior wall. What about transversus abdominis? No, it does not form the anterior wall of inguinal canal. Let's go to who forms the posterior wall. Posterior wall is formed by 1, 2, 3. Reflected part of inguinal ligament, conjoint tendon, fascia transversalis. Okay, you can see the continuation of fascia transversalis here. So, reflected part of inguinal ligament, conjoint tendon and fascia transversalis form the posterior wall. The whole canal is supported further posteriorly by extraperitoneal tissue and the peritoneum. Please practice drawing this. It will help you to remember the whole thing much better. This, of course, is your inferior epigastric artery. Let's now see if a hernia descends down medial to the inferior epigastric artery, you call it a direct inguinal hernia. And if it comes through the deep inguinal ring downwards, then you call it a indirect inguinal hernia. These are basics. Medial to inferior epigastric, direct. Lateral to inferior epigastric, indirect. Okay. So with this basic anatomy in place, let's begin MCQ 1. Following is true for the deep inguinal ring. That's the first MCQ. So that means you're going to look for something which is correct. Okay. So let me mark this for myself. It must be correct statement. Okay. So here you're looking at again the diagram. In this case, in the exam, you're going to imagine the diagram. Today, I'm keeping it next to you. Okay. Deep ring is a defect in transversalis fascia. Yes, it is. You can see it here. Okay. Indirect hernia comes out lateral to deep ring. What did I tell you? Inguinal hernia actually comes through the deep ring. Okay. Pantaloons hernia can be on medial side of deep ring. Pantaloons by name is on either side. Okay, there are two hernias which are on either side. So this statement is incorrect. This statement also is incorrect. Direct inguinal hernial sac comes out of the deep ring. This is your deep ring. Direct hernia is always medial to the inferior epigastric artery. It would be here. Right? So this statement also is incorrect. Therefore, following are true for deep inguinal ring. Deep inguinal ring is a defect in transversalis fascia. That's the answer. So A is your correct answer. Let's go to the next MCQ. Length of inguinal canal is. Now here you just don't have to bother. You know it is a 4 centimeter long canal. So that's it. A is the option. So in exam, you get some difficult and some very easy MCQs. This is one of the very easy ones. Okay. Let's go to MCQ 3. Following structures form the anterior wall of inguinal canal. My suggestion to you is ask yourself, do you know these structures? We've done this. Skin superficial fascia, aponeurosis of external oblique, internal oblique muscle. This was the diagram and these are the 3 structures that should come to your mind. Now let's look at the options. Aponeurosis of internal oblique? No. Aponeurosis of external oblique? Yes. Transversalis fascia? No. What is transversalis fascia? It forms the posterior wall of inguinal canal. So this is incorrect. And what about external spermatic fascia? It doesn't come in this at all. So the following structure forms anterior wall of inguinal canal. Answer is aponeurosis of external oblique, point B. Got it? Always better to ask yourself what you know before you look at the options. More likelihood of your getting your MCQ right. MCQ 4. Following are true about external or superficial inguinal ring except. So all the options are going to be true and you are looking for an incorrect option. Okay. So superficial inguinal ring. What is it? Let's practice our method. Superficial inguinal ring is a gap in the aponeurosis of external oblique. Shape, it is triangular in shape. Okay. This much all of you know. So it's not a ring. Yeah, it's not a ring. It's triangular. So this is correct. It is a defect in the internal oblique aponeurosis. No, it is incorrect. It's a defect in the external oblique aponeurosis. Invagination test is done through the external ring. Yes, it is. It transmits spermatic cord. Yes, it does. Okay. Now, it sometimes happens that you don't know what is invagination test, but you've already seen the obviously incorrect answer. So many times it happens that we don't know all the options. We don't understand what the other options are. But you've already seen that it is a defect in the internal oblique aponeurosis is an incorrect statement and therefore has to be our answer. Okay. We'll now move on to the next. So yes, B is the answer. MCQ 5. Inguinal ligament is a modification of. Pause and ask yourself, what is it a modification of? We already know. Inguinal ligament is a modification of aponeurosis of external oblique. Is there an option here? External oblique muscle? Yes, so that has to be the answer. Lacunar ligament, Cooper's ligament are modifications of inguinal ligament. Internal oblique does not modify itself to form any ligament. Okay. So, let's see if our answer is correct. Yes, it is. Okay. MCQ 6. Following is an incorrect statement about conjoint tendon. So, let me mark it here. I'm looking for an incorrect statement, a wrong statement. Okay. It is formed by fusion of aponeurosis of internal oblique and transversus abdominis. Take a look. Yes, internal oblique and the transversus abdominis are uniting to form the conjoint tendon. So, this is a correct option. It forms medial half of posterior wall of inguinal canal. Medial half of posterior wall of inguinal canal. Yes, it does. So, this is also correct. It is attached to pecten pubis. Yes, it is. It provides support to deep inguinal ring. No, it doesn't. Deep inguinal ring is over here. Conjoint tendon is so far away. There is no way it can support the deep inguinal ring. But it can support the superficial inguinal ring since it lies immediately behind it. Take a look at this diagram again. Yes, D is the answer. Let's convince ourselves a little more. Here you are seeing the conjoint tendon. Here you are seeing the deep inguinal ring. They're so far apart, one cannot support the other. However, conjoint tendon does support the superficial inguinal ring, and therefore D was our correct option. Let's move on to the next MCQ now. MCQ 7. A man developed direct inguinal hernia several months after undergoing appendicectomy. So he's undergone which surgery? Appendicectomy surgery. Okay. The cause was predicted to be a weakened falx inguinalis. What is falx inguinalis? Falx inguinalis is same as conjoint tendon. So his conjoint tendon has become weakened. Which nerve was injured during the surgery? Now understand that. Here you can see the weak conjoint tendon and you can see how it is bending to allow for a direct inguinal hernia. Okay. So now question is, which nerve supplies the conjoint tendon? Remember, the conjoint tendon is supplied by ilioinguinal nerve, which pierces the internal oblique to finally enter the inguinal canal. It supplies the internal oblique such that the internal oblique is able to contract and bring about the shutter mechanism. The nerve can be if there is history, the nerve is easily damaged in appendicectomy and therefore results in direct inguinal hernia. This is all clinical history. This has happened earlier. So let's go back to our same MCQ. Which nerve was injured during surgery? The nerve, can it be femoral branch of genitofemoral nerve? No, femoral branch is a cutaneous branch which supplies the anterior aspect of your femoral triangle region. Subcostal nerve again does not reach this region. Ilioinguinal nerve, yes, according to us, that's the option. Genital branch of genitofemoral nerve again is an incorrect answer. It supplies cremasteric muscle. So let's see, are we correct? Yes, we are correct. So this is how we try and use logic, okay, and our memory, of course, to come to answers. During dissection, if you had to look for deep inguinal ring, okay, you're dissecting and you're looking for the deep inguinal ring, where will you look for it? There's a cadaver lying in front of you. For this, you have to know surface marking, which is what all of us, we get bored, right? You have to know surface marking, which says that deep inguinal ring is a point 1.25 centimeter above the mid-inguinal point. So in the options, we've got supravesical fossa, no. Medial to inferior epigastric artery, no. Above mid-inguinal point, yes. Above pubic tubercle, no. Understand that above pubic tubercle, you would find the superficial inguinal ring, okay. And medial to inferior epigastric artery, definitely not, okay. So deep inguinal ring is found above the mid-inguinal point, 1.25 centimeter above it. That's the, so C is what we think is the right option. Yes, it is. Students, I have just put up the surface marking of superficial inguinal ring, and MCQ similarly can be asked about superficial inguinal ring as well. So, till now we did some MCQs which were purely based on anatomy of inguinal canal. Let's move on to MCQs based on content of inguinal canal. Content in male, content in female. Okay. So again, brief of anatomy. Here you are seeing a spermatic cord transection. Along with it, in front of it, ilioinguinal nerve. These are contents of inguinal canal in the male. Okay. So here we are seeing that the spermatic cord is covered by 3 fascia: external spermatic fascia, cremasteric fascia, internal spermatic fascia from outside inwards. Okay. Between internal and spermatic fascia, cremasteric fascia, you can see cremasteric blood vessels and nerve to cremasteric muscle, genital branch of genitofemoral nerve. Here in the front, you can see the ilioinguinal nerve. Now let's talk about what is inside the spermatic cord. I can see vas deferens and the artery to vas deferens. I can see testicular artery and sympathetic plexus around it. a lot of cut blood vessels, pampiniform plexus, and the obliterated processus vaginalis. So remember, spermatic cord is not just a content. The contents of spermatic cord are also contents of inguinal canal. So you have to know all these to be able to solve the MCQ. Let's talk about a female. In the female, again, inguinal canal contains round ligament of uterus, okay, and ilioinguinal nerve, along with sometimes a small peritoneal pouch called the canal of Nuck, N-U-C-K. Very often asked in vivas, it's asked in MCQs as well. Okay. Now remember, this canal of Nuck is not always present. If present, it could be a site of potential indirect inguinal hernia. Okay. So males में क्या content देखा? Spermatic cord, ilioinguinal nerve. Inside the spermatic cord, what are the structures we should remember? 3 fasciae. External spermatic fascia, internal spermatic fascia, and the cremasteric fascia and muscle in between. Cremasteric muscle therefore has to get nerve supply, genital branch of genitofemoral nerve. Inside the spermatic cord, you will see vas deferens and artery to vas. Testicular artery, sympathetic plexus around it. Pampiniform plexus, obliterated processus vaginalis. Also, of course, lying anteriorly, you will see ilioinguinal nerve. In the female, you will see round ligament of uterus. Remember, it's not round ligament of ovary. It is round ligament of uterus and ilioinguinal nerve, along with sometimes canal of Nuck. Keep this in your brain. Fit it. Let's move and solve some MCQs. All right. Chalo. So, MCQ 9. All structures passing through inguinal canal except. So, since they mentioned spermatic cord, it's probably the male. Okay. So, all are structures passing through inguinal canal except. I'm looking for an except. Okay. So, spermatic cord, yes, it's there. Ilioinguinal nerve, yes, it's there. Inferior epigastric artery, no. Genital branch of genitofemoral nerve, yes, it's there. Remember, it supplies the cremasteric muscle and therefore is a content. So, except which one? Except inferior epigastric artery, which must therefore be the answer. C is the answer. Okay. So, when you study even in short for MCQs, especially in anatomy, you find yourself solving them easily. A patient had indirect inguinal hernia. Indirect means it comes through deep ring, moves towards superficial ring, traversing the inguinal canal. A patient having indirect inguinal hernia into the scrotum complained of pain in the scrotum. Which nerve could be causing pain? Can it be iliohypogastric? Can it be ilioinguinal? Can it be femoral branch of genitofemoral nerve or subcostal? See, neither subcostal nor femoral branch of genitofemoral nor iliohypogastric reach the scrotum. The scrotum is supplied by ilioinguinal nerve in the anterior part, and therefore that has to be the answer. If the nerve doesn't reach the scrotum, there is no way it's going to give pain, right? So, B is the answer. Logic. If the nerve doesn't reach an area, how is it going to carry pain sensations from there? Next MCQ. All are structures passing through inguinal canal in female. Again, pause, think. In female, round ligament of uterus, ilioinguinal nerve, canal of Nuck. Come back. So, my options are round ligament of ovary. No. Round ligament ovary is a no. It's round ligament of uterus. Canal of Nuck, yes, it's a content. Ilioinguinal nerve, yes. Round ligament of uterus, yes. So, I was looking for the wrong answer, except, therefore, round ligament of ovary has to be the answer. A, absolutely right. So, logic and memory will help you solve MCQs. MCQ 12, in a female with indirect inguinal hernia, female with indirect. So, from deep ring to superficial ring, the hernia is going to pass. Okay. In a female with indirect inguinal hernia, the hernia lies next to following structure in inguinal canal. So, hernial sac is accompanied by what in the inguinal canal? It will be accompanied by either ilioinguinal nerve or round ligament of uterus or canal of Nuck. What are the options? Iliohypogastric nerve. This never enters inguinal canal, so cannot accompany the hernia. Round ligament of uterus, yes, possible. Inferior epigastric artery does not enter inguinal canal. Ovarian artery does not enter the inguinal canal. So the structure that can accompany indirect inguinal hernia in the female is round ligament of uterus, point number B. Yes, that's the answer. MCQ 13. Which of the following structures passes through the deep ring? Okay. So in the male it's spermatic cord, in the female it's round ligament of uterus. What are my options? Ilioinguinal nerve? No, it doesn't pass through. Ilioinguinal nerve, although it's a content of inguinal canal, does not pass through deep inguinal ring. I'll tell you why. Let's see the other options first. Round ligament of uterus, yes, passes through deep ring. Inferior epigastric artery does not. Medial umbilical ligament does not pass through deep ring. But you're wondering, why not ilioinguinal nerve? It's very much a content of inguinal canal. See, ilioinguinal nerve pierces the internal oblique to enter into the inguinal canal later. It does not pass through the deep inguinal ring to enter into inguinal canal. It enters into it by piercing the internal oblique muscle. That's why ilioinguinal nerve is also not an option of structures passing through deep inguinal ring. Let's come to MCQ 14. Between which of the following layers will we find inferior epigastric vessels? Okay, so let's take a look at this diagram. Inferior epigastric vessels are found in which layer? I can see fascia transversalis, I can see peritoneum. I can see fascia transversalis, I can see peritoneum, and in between these two here, in the extraperitoneal tissue, lies the inferior epigastric artery. Okay, now I've got my artery in my brain. Let's go back to our options now. Skin and external oblique aponeurosis, external oblique and internal oblique, transversus abdominis and fascia transversalis, transversalis fascia and peritoneum. Let's look at these now. Here, skin and external oblique. No, you cannot find inferior epigastric here. External oblique and internal oblique. Can you find inferior epigastric in between? No. Transversus abdominis and fascia transversalis also no. So, option number 1, option number 2 and option number 3 or A, B, C are all incorrect. I find my inferior epigastric artery between transversalis fascia and peritoneum. D is the correct option. Okay. So, students, this is how you solve simple MCQs using some basic anatomy. Use images that I have given you. You can even take screenshots of them. Okay. Brush up the anatomy, solve MCQs. Brush up anatomy, solve MCQs. If you're smart, just go through this once more. I don't think you are ever going to forget this. This is how good MCQs can be and how easy MCQs can be if solved using knowledge and logic both. This will be followed by MCQs on Inguinal Region Part 2 and 3. Part 2 and 3 will deal with direct inguinal hernia, indirect inguinal hernia and some embryology based questions which are also asked in the inguinal region. All the links are given in description section. And if you feel that you don't have time to read the inguinal canal anatomy, then please go and watch videos made about anatomy of inguinal canal 1, 2, anatomy of direct and indirect inguinal hernia. They are made for you to quickly brush up anatomy before you start your MCQ solving, right? So students, keep studying and I'll see you in the next MCQ solving session. Bye.